The last section that we really want to look at is, what do I need to do so that I don't have to go through this process again? So I've already had a stroke and I did the rehab, so I should be good, right? Most importantly is no. Unfortunately, medicine and therapy alone cannot prevent another stroke. And even once you've had a stroke, the likelihood of you having another stroke are significantly higher than somebody who's not had a stroke at all. Certain things such as lifestyle factors or even just general characteristics put you at a much higher risk for having had a stroke. Some of the things that are likely to put you there are higher blood pressure, diabetes, heart disease, a history of smoking, obesity, increase in age. We also have recreational drug use, most specifically cocaine and meth, excess alcohol consumption, a family history of strokes. Certain genders or race are more likely for you to have a stroke. So within the African American community, they typically have a much higher risk of having a stroke than any other race. And within gender, males are more of a risk than there are females. And that's not just because of who you are, what you've done. It's just from a genetic component. That's where you are. So what changes do I need to make? And how do I prevent this from happening again? The biggest issues that we have really are, looking at some of the things that you do to your body, whether it's, the food that you eat or other habits that you're adding. Make sure that whatever you're putting into your body is somewhat healthy, because it is going to play a toll onto the rest of your generalized health. So the most important one is really, we want to try and quit smoking or drastically reduce the amount of smoking that you have. We also want to reduce or eliminate alcohol. Really start to increase your exercise and try to maintain a healthy weight. Reduce your stress level, and then take the medication that your doctors have prescribed, and then get your regular medical checkups. The really good thing with any of these suggestions is that often if you just start doing one, you're more likely to increase the other activity. So whether, let's say, you decide I'm gonna quit smoking. So even if you're just reducing the number of smokes that you smoke, it's going to make you feel slightly better. You can have greater oxygen ability to do things. And if you put it in your mind to start exercising as well, you'll feel better by doing exercise because you have more oxygen. The more exercise that you do, it's automatically going to help maintain your body weight and going to reduce your stress level, as well as ultimately reduce your blood pressure. So by taking two of those factors out of the entire list, you've already reduced your risk of having another stroke substantially, just because you're having a domino effect of everything else. These lifestyle changes aren't always easy, and that's why we're really here to help you to sort of make these changes as we go forward. Remember, there's always somebody out there who's more than willing to help you do something if you just ask. So what should I continue to monitor when I'm back at home? Well, the most important thing that we really want you to monitor is your blood pressure. So a normal blood pressure is typically 120/80. Some of the warning blood pressures that we really are a little concerned about are blood pressures that are in the range between 120 and 139 for your systolic, and then between 80 and 89 for your diastolic. And then a high blood pressure that we're really starting to get concerned about is anything that is higher than 140/90. Just remember, within these high blood pressures, it's really placing you at a higher risk for either a hemorrhagic stroke, if your vessels are a little bit weaker, in which there's so much pressure that it's actually causing your artery to burst, or if you do actually have more of a higher cholesterol and you do have the fat that's sort of building up. With the higher pressure, it could actually dislodge some of the cholesterol along the lining of the artery, and therefore actually generate an embolic stroke, which we don't want that either. We also want to make sure we're paying attention to our glucose or our blood sugar levels. So your normal blood glucose level is typically about 110. When we're starting to get a little concerned is if it's a little bit higher than 160. So your glucose with your diabetes is something obviously that you want to work quite closely with your doctor to help you maintain what your fluctuations are. We don't want it lower than 110 because that can cause some issues, but we also definitely don't want it higher. So having that fine balance between what your ranges should be really is going to be working with the doctor to help you do that. Some of the medications, a lot of the medications are really there to help you manage your blood pressure as well as your glucose levels. And you also want to make sure that you take your medications, only the medications that your doctor has prescribed to you, also at a regular time or interval that the doctor has prescribed them to you. So once again, some of the things that you can do if you're having issues with this, Health4TheWorld has also created sections within its app under the Learn section and the Reminder section, not only to help you understand what's going on, but also to help remind you of when you have your doctor's appointments, which medicines you need to be taking, and at what time frame you're supposed to be taking them. So we're there to help you even if you don't have access to your doctor. Just know that we are there if you use the app. And then also, once again, too, some of the things that change too is your cognition and your thinking. You want to be able to go to your doctor or send somebody to the doctor if you've noticed some sort of change in your thinking pattern. Sometimes that change in your thinking pattern is the actual first warning sign that you could be close to getting or having a stroke, which obviously we want to try and prevent that from happening as soon as we can. And then how can I find help if I need it once I've left the hospital? So remember, your rehabilitation does not stop once you leave the hospital. You always want to ask your doctor for any local or national resources. Once again, turn to Health4TheWorld app. You want to look at that Learn section. It is a really comprehensive education tool for all aspects of health and lifestyle once you're discharged home. The Reminder section too also can really help you with your medical appointments and your medical reminders and schedules. And then how can I find help if I need it once home? These primarily are stroke education resources for the United States, but if you have access to the internet, you're able to use any one of these websites to find whatever information you're looking for. I'm just going to have you can sort of access the resources here. I won't really go through them. But, in most cases, if you're also not getting the resources that you're looking for, just turn back to your doctors that you're seeing in the clinics. They should be able to direct you to whatever resource that you're looking for or help you step by step through the process.